Namaskaram. My name is Dr. Virinchi Sharma and I'm a consultant psychiatrist from Hyderabad. When we talk about COVID, the biggest question is, what are the do's and don'ts during an active infection? What we usually see is, as soon as somebody gets a few symptoms or flu-like symptoms, the first thing that we do is we start Googling about what this could be. And right now, today on Google search, the first thing that you will be seeing is coronavirus. So probably even if you don't have the virus, you start panicking thinking that it is a COVID infection. So the first thing when somebody has flu-like symptoms is talk to your consultant doctor. Most of the times the doctor next suggests an RT-PCR test. So this is a test which tells you if they detect the virus in your body. Sometimes in the second wave what we see is there could be RT-PCR negative coronavirus also. So that means this virus is not detected in the RT-PCR test. In such times, if you continue to have the symptoms, the next thing that you should be doing is go for a CT chest. 2. Keeping the symptoms and the treatments aside, what are the things that we should be doing and not doing to make sure that we do not worsen the condition? 1, I would suggest everybody to stop watching news. Every time you watch the news shows you the number of new infections and the number of deaths. Such negative information can worsen your mental health. And this worsening of mental health has a direct impact on your physical health. So every time there is stress in the body, this stress worsens your immunity. And this worsening of immunity can further increase your infection. A lot of times, anxiety and panic can also worsen your difficulties with breathing. Already somebody who's having a lung infection could be having worsening of symptoms in regards to their respiration. A lot of times people, because they are isolated, create bad habits like not sleeping at the right time or not eating at the right time. So worsening in your biological functions like sleep and appetite also could be worsening your immunity. Sometimes people over-enthusiastically start doing yoga and meditation while having a live infection. Already when your lung is affected, putting some more pressure is also a wrong thing. So a lot of things that we do believe is right is actually wrong. What are the things that we should be doing? 1, maintaining a proper sleep hygiene and an appetite. 2, making sure that we are constantly communicating with family members through technology. 3, making sure that we are eating proteinaceous food so that our body can withstand the virus inside. 4, making sure that the content we give to the brain is more of a light-hearted or a comedy kind of a thing which can create laughter and happiness. 5, it is very important to understand that your mental strength can actually prevent worsening of these symptoms. So, do activities that keep you strong, read some spiritual books, read some motivational books, and make sure that your mental health is strong so that it can prevent worsening of the symptoms. Thank you.
And want to discuss what can be the pros and cons of pushing the fertility further. Now, in them, when we see that the lady 35 years plus, a lady is born with a fixed set of eggs, which is around